Afternoon, everyone. Right to go? Yep. Okay, thanks everyone for coming along this afternoon. Today we'll be talking about the emergency situation as well as giving the daily COVID update. So I'm joined by our COVID-19 Commander and also the Emergency Management Commissioner, and we'll hear from Jerome and then Andrew respectively. So in terms of today, there are 54 active cases of coronavirus in Victoria. There is one new locally acquired case in today's numbers and one new case in hotel quarantine. Today is a good day for Victorians, but the developing situation in New South Wales is a sobering reminder that this virus is with us in our country and will be with us for quite some time. The one new locally acquired case lives in the same household of an existing case at the South Bank complex, bringing the overall number of cases to 9. We identified this case thanks to regular and rigorous testing of primary close contacts. The public health team were able to contact trace her movements, so there are no new additional exposure sites, and that's a good outcome. Excellent progress is being made across all the outbreak areas with huge testing numbers, more than 35,000 yesterday, and I want to thank all Victorians. That is a very good number, and we want to keep those testing numbers up as high as we can. So this gives us cautious confidence as we ease restrictions safely across the state from today. Staying COVID safe needs to be front of mind, not only for this weekend, but for the weeks and months ahead until we get to a position where our vaccination rates are as high as they can be. We announced late yesterday that the Woollahra, Waverley and City of Sydney local government areas in New South Wales are now designated as orange zones from the 11th of June under Victoria's travel permit system. Permit checks are in place at our airports, and we've already sent more than 4,500 messages asking people who are travelling to get tested and isolate until they receive a negative result and check the New South Wales public exposure site listings. It's important that everyone arriving into Victoria from these areas in New South Wales visits the Service Victoria website and obtains an orange zone permit, and Jerome will speak more about that in a moment. Yesterday, there were 16,710 vaccine doses were administered by Victoria State Commission Services. That brings the total number of vaccine doses administered at state sites to 868,512 vaccine. In terms of the emergency update, as at 7 a.m. this morning, there were still 5,634 households without power in the AusNet service area, and the majority of those are in the Dandenong Ranges. According to AusNet's latest estimates, approximately 4,629 customers are anticipated to be restored from today until Sunday, and 218 additional by Friday the 25th of June. But as we know, there will be a number of weeks in the depths of winter where many thousands of people will be without power. So yesterday we announced a prolonged power outage payment of $1,680 per week, extended to all eligible households without power as at Thursday, the 17th of June. The payment will be assessed on a weekly basis and administered by AusNet, and will help families buy goods and supplies if they're staying in their home, and it will also assist households in terms of finding and paying for alternate accommodation. At this point, I want to thank the Commonwealth. We've had some terrific engagement with the Commonwealth, both in terms of the ADF, which I'll speak about in a second, and the prolonged power outage payment. The Commonwealth have confirmed that they'll be going 50-50 with the state, and I want to thank the acting Prime Minister and the Commonwealth for their support and engagement in supporting Victorians during this time. AusNet are contacting eligible households today, and AusNet also has a dedicated storm relief hotline 1300 561 171, 8 a.m. to 8 p.m. 7 days a week. So contacting all eligible households today, but there's also the Storm number that people can contact. In terms of the personal hardship assistance payments, so this is our standard one-off payment to families in an emergency. 199 payments have been made, totalling $222,240. As of the 17th of June, 1,868 initial impact assessments have been completed. We've got 119 properties that have been classified as uninhabitable and 112 that are damaged but are habitable. In terms of what's happening on the ground right now, there are more than 500 active volunteers across the Dandenongs, other parts of metropolitan Melbourne, Gippsland and the Grampian regions assisting with our response to this disaster. So emergency service volunteers and other volunteers, more than 500 active. There are additionally several hundred volunteers on standby crews for the expected weather over the next few days, and Andrew will talk to that in a moment. But combining the volunteer numbers with career staff from the SES, CFA, Fire Rescue Victoria, DELP, including Forest Fire Management, Department of Transport and VicPol, we have over 1,000 people on the ground in affected storm areas right now. In addition to that, there's around 390 staff from AusNet working hard to get people back connected to power. As I said yesterday, we have had an initial request to the Commonwealth for ADF support. The initial request was for planning and logistics. I said yesterday that there will be further requests of the ADF, and I can confirm that a request will be made today for a further 120 ADF personnel to help with our efforts, and it will go towards road clearance, general clear up, community assurance, door knocking, and again, Andrew can go to those matters as well. So at that point, I'll hand over to Jerome to give a COVID-19 update, then Commissioner Crisp on the emergency, and then we're happy to answer questions. Thanks, Jerome.
Thank you, Acting Premier, and good afternoon. 35,000 tests, 60,000 test results over the last 2 days is an excellent response. I'm very grateful to all those Victorians who came out to get tested, particularly in response to the recent exposure sites we identified in the last 48 hours. We are making really good progress now in clearing up the primary close contacts of the older parts of the outbreak. Over 90% of the primary close contacts for West Melbourne, for the City of Whittlesea and for Port Melbourne have now all been cleared. We are now starting or going through our day 13 testing at the Our Care aged care facility, and subject to that going well over the next few days, we hope to return that facility after Sunday back to normal operations, and that will be a real relief, I know, to the residents and families of that facility, and they've done so well over the last 2 weeks, and my thanks to them for getting us through this really complicated outbreak in that most sensitive of our settings. With regard to South Bank, again, we've seen a really phenomenal community response to the outbreak at South Bank. As the Acting Premier has said, we do have one more case today, but it's an existing known family contact, household contact of an existing case in the same corner of the complex that we've been focusing upon. She was last tested on the 14th of June and returned a negative test. Last tested again. We're on a 2-day testing cycle with people in that facility. She tested positive yesterday, so she will continue her 14-day isolation as we go forward. That means we now have 9 positive cases associated with the South Bank cluster. There are 199 residents now identified in the wider Kings Park complex. Of those, everybody who's in the most sensitive setting, the sensitive corner, 19 have tested negative, and of course the 9 positive cases we already have. Of the remainder, 137 of the 171 remaining residents have all tested negative so far, and we continue to test as we go forward. And again, a very strong response there yesterday. I'd spent some time yesterday going through our concerns at Epping Private and the positive nurse case that we've had there. I'm pleased to say we're seeing a really good set of negative results coming through from a fairly wide group of staff that have now been tested. At Epping itself, 34 staff are currently furloughed. Of those, 24 have returned negative results, and some of them will be able to return to work. Others will need to wait for their negative results. There will be 11 staff who are furloughed for the full 14-day period. At Northern, we've had 67 people identified as primary close contacts. 55 of those have already returned negative test results, and we're waiting for the remaining results to come in. And at the vaccination clinic at Northern, all 7 staff who were identified have all returned negative results, and half of the 55 patients who were in the facility at the time have also returned negative results. They will all undergo their full 14-day isolation. Again, my thanks to the staff and teams at Northern and at Epping for their support over this. It's a very important, but it's been a very rapid response to that particular positive case. It's an important 24 hours, 36 hours to see whether we have any other seeding out of that particular infectious case, and we'll give more updates on that over the weekend. The active premiers, of course, referred to our colleagues in New South Wales, and we of course are here to support them as they deal with the early runnings of their outbreak. As of yesterday morning, all of our authorised officers are now meeting all Sydney arriving flights at Melbourne and ensuring we have completed travel declaration forms completed for those arrivals. 4,500 or 4761 text messages were sent out yesterday morning to Victorians who've recently arrived back from the 3 impacted Sydney LGA areas. And of course, we continue to work with interstate colleagues to assess how that exposure is going, how that outbreak is going, and we'll adjust if we need to the settings that we have. With regard to vaccinations, this week so far we've completed 39,000 first doses and around 18,000 second doses. I've got 30,000 appointments booked for the rest of this week today and over the weekend. We still have 8,500 Pfizer bookings available for the rest of this week. In terms of next week, we have 27,000 first doses booked in for next week, 42,000 second doses booked in, and we still have 26,000 Pfizer slots available for next week. And of course, the online booking system continues to perform well, give, I think, people far greater clarity about the options available to them across the 49 clinics that we use for both our Pfizer and AstraZeneca vaccination platforms, and that will continue to be available not only for the next few weeks, but also as we book further ahead into the end of June and into July. Obviously, the ATAGI announcement and more importantly, the Commonwealth's decision on the back of the ATAGI advice yesterday means that we have now taken a proactive stance. We have 3,000 50 to 59-year-olds who are already booked in for an AstraZeneca first dose. We have converted all of those appointments to Pfizer doses, so people who have had a confirmed booked appointment for AstraZeneca, if they're in their 50s, that will now be a Pfizer appointment, and we are contacting them to make sure that they're comfortable with that. I'd urge anybody who has had, like me, their first dose of AstraZeneca, then please come forward when your time is due for your second dose of AstraZeneca. And of course, we'll continue to assess options with the Commonwealth around the longer-term implications for the rollout programme. With the easing of restrictions, a huge step forward again for our state as we move beyond these outbreaks. There are 2 things we would really ask all Victorians to do. One is to really start using the QR codes. We now have 178,000 businesses that are using the QR codes. There are over 400,000 printouts of QR codes around the state, and I think yesterday we're seeing around 3.8 million daily uses of the QR codes. That's a really encouraging start. It's far bigger than where we've been, but obviously we need to do far more, and it really needs to become part of our daily habit to use QR codes wherever we go. So I'm very grateful to the business community for their widespread support and uptake of this platform, and I'd encourage everybody as we emerge out of this current stage of lockdown to start using it proactively everywhere we go, in our buildings, in hospo, in retail, and at our workplaces. And of course, finally, testing. 60,000 tests over the last 2 days has really helped us to identify any other areas of concern. I would please ask people to continue to be vigilant over the days and weeks and months ahead. Any signs of symptoms, please get tested. Any exposure to those exposure sites, please get tested. And if you're not sure, please go and get tested anyway. With that, I'll hand over to Commissioner Crisp.
Thanks very much, Jerome, Acting Premier. So currently, as a result of last week's weather and storm event, we have advice messages for minor flooding still from the Yarra through to the Latrobe River. With the weather we'll experience today and over the weekend, we will see advice messages for minor flooding also go to the Cairn River, to Genoa and the Bem River. That's because that's where we expect to see the greater rainfall today and over the weekend, up to 50 millimetres and possibly up to localised falls of 60 millimetres in the far east of the state. As we move back west in the state, the southwest area that was impacted last week, particularly around that Traralgon area, we might see up to 15 millimetres of rain, and that's the average rainfall we'll see across the state more generally. Wind speeds, as we know, will play a significant issue with regards to risk to communities. When you look at the saturated areas that we've got, where we've got trees that are still will be unstable. So in terms of wind speeds, if I look at an area like Trentham, there's forecasts of around about 30 kilometres an hour. Similarly, up in Mount Dandenong, so through the Dandenongs itself. However, we will likely see gusts up to 60 kilometres hours in the alpine areas and elevated areas. So the clear message around that, particularly for communities in those areas that were impacted last week, it's about staying across the messaging that we might push out in relation to the risk that still exists as a result of this current weather event that we will see from today easing through into the weekend. Weather will then stabilise, and we probably will not see any further rain until about Wednesday of next week. The Acting Premier has gone to the number of people that we have, both volunteers, career, public servants that are working at the moment in support of the state, and it is more than 1,000, with 390 in addition to that from AusNet. We also have regional control centres, instant control centres set up at Traralgon, at Ferntree Gully, an instant control centre at Ballarat. So adding to the numbers the Acting Premier has already spoken about, there's at least 250 other people, including the State Control Centre. So there's significant support to what's actually happening on the ground, supporting that 1,000 plus AusNet and the work that they're doing to ensure that we are well and truly coordinated. We also have had, and we need to pay attention to other organisations such as the Red Cross, the Victorian Council of Churches, local government, all been doing an absolutely incredible job out on the ground, connecting with communities, doing what they do so well. I want to take this opportunity to thank all of those people, and particularly those volunteers, and thank their families, because again, it's the families that are looking after their families and keeping everything going at home, while these people are again giving back to their community. So significant effort actually happening on the ground at the moment. Whenever you have an emergency, we run through a number of different phases. So that initial phase is very much about protecting life. When we talk about our state priorities, that's first and foremost, whether that's in relation to the community or our emergency services. And we know what we saw last Wednesday night was definitely a threat to life, and as it was eventuated, definitely a threat to property in many parts of this state. You need to work through that emergency situation. You need to assess what you've got, and then as you assess, you then look at what other additional resources you need to support the community more broadly. We're at a point 2 days ago where, as a catalyst and on the back of the announcement in relation to at least another 2,000 people that will be off power until at least the 10th of July, that we knew that we would need additional support, particularly in relation to those impacted communities. That was when a request for assistance was made to the Commonwealth, and I thank the Commonwealth and the Australian Defence Force for very quickly responding to that request for assistance. So we actually did have 5 planners, logisticians, along with a senior liaison officer in the State Control Centre yesterday. We have continued to work through what a plan is for further support from the Australian Defence Force. And as the Acting Premier has spoken to, so very much a key part will be those communities that are impacted by not being back on power till the 10th of July. So what they can do, working with, again, the Red Cross, the Victorian Council of Churches, to door knock, to undertake that community reassurance work. What we saw worked really well during the bushfires of 2019-20 was also the Australian Defence Force supporting the efforts at relief centres, at community hubs, again, being that reassuring face and uniform in support of the broader community. We can use those resources in a number of different ways. So that we will also ask for resources to support us in relation to other tasks around around chainsaw use, about road clearing, about debris clearing. But as we've previously mentioned, they only have a certain skill set and capability, and they're not the sort of resources that we can use up in the Dandenongs with the mountain ash, with those, as we've seen, very big, very dangerous trees. That requires a level of skill even above the SES. So that's where we're using specialist arborists and tree climbers to do that really, really important piece of work. So we will continue to work with the ADF. We will put in another request for today. We're working directly with them. The ADF will always talk about 72 hours notice, but I am confident that we will have ADF resources on the ground within the 72 hours to provide further support to the Victorian community. So the Victorian community and those impacted communities should be assured, they should listen to those numbers. We will continue to work with you. Bushfire Recovery Victoria has been established to coordinate recovery at a state level and at a regional level. And they're already out on the ground. They've nominated already people to take the lead, particularly in relation to the work that happens in the Yarra Ranges. We are coordinated. We have effective control in relation to these operations, and we will continue to do that. If I swing back to where I started with the weather and what we're likely to see over the next few days, again, we have both the volunteers and the career staff that are out there now, but we have that surge capacity. We have other resources that we can call on to that will provide the support to the Victorian community. The Acting Premier and Jerome and I are now happy to take any questions.
Nearly 9 days since the first of these and the most damaging of these storms swept through. Why has it taken more than a week to make that request to the ADF?
You have to remember that you've got to step this through. In the very, very early days, it was still extremely dangerous. It was a matter of about assessing the consequences of that particular weather event. It's not as though we didn't have anyone working on the ground. The Premier's talked to at least the 1,000 have been working. And we've had those numbers from day one that have been doing the great work. You only have to look what's been done in the Dandenongs. Again, just to give you another number, we believe there's been about 482 roads impacted as a result of last week's weather event. We're down now to 414 of those being cleared. With the resources that we've actually got, there's various conditions in relation to some of those roads, but again, that's been an incredible effort. So the time is right. When we brought the ADF to make the request, to work through a process, they would expect that of us, to bring the planners in to do that work, and now within 24 hours, we're ready to go with another request.
How many ADF staff did you initially request when you made that first request? I understand it was on Wednesday.
That's right. We asked for 5 to come in and do that planning work with our planning team, so planners and logisticians.
And how many are you asking for now?
We will ask for another 120 today, and we'll continue to review, and that's exactly what we should be doing. Again, working with the planners. If we see another need, we will make further requests. The state has not been afraid to ask for ADF support, whether that's in relation to the 2019-20 bushfires, where on some days we had more than 1,600 ADF supporting the Victorian community. We had ships, we had helicopters, we had planes, we had all of that great support from the ADF supporting the Victorian community. The COVID emergency, at this current time, we have more than 400 ADF supporting that particular operation. So we will continue to go to the ADF, and we appreciate their support.
It's still not really clear why it took so long, though. Why did it take a week? I mean, it was pretty clear that morning that there was a huge amount of damage and that whatever the task was, it was going to be massive. Why weren't you looking at asking for every bit of help you could get?
When you step through those phases and the time is right, that's the point I'll continue to make, the time is right. There is no point requesting 1,000 ADF resources if you don't know what you're going to do with them. So you need to do that initial assessment so you can best utilise their capability and capacity. The time is right now.
Maybe you just underestimated the enormity of the task in the first few days, and you're only coming to that realisation in the last couple of days?
We realised last Thursday in relation to the significant impact on the community, and we have had significant resources working on this particular event. The time is right. We actually have a commitment in relation to the way that we work with the Commonwealth that we utilise our resources in the first instance, and that's exactly what we've done. I'm confident the time is right to bring in the ADF now.
How do you rate the overall response since day one?
the overall response, whether that's from the SES, CFA, Victoria Police on the night, has been absolutely incredible. They literally put their lives on the line. When you look at the amount of work, and the Acting Premier, myself and the Acting Premier living up in the Dandenongs, I've been up there a couple of times. If you look at the clearance work that has already gone on to enable the community to get around those roads, it's actually phenomenal when you look at the size of those trees and the work that has been done. And it's important to remember that we don't have any community at the moment that's actually geographically isolated. They can still move around, and that's not the situation we had during the 2019-20 bushfires.
When there's a request for ADF, how long does it take to get boots on the ground?
We made the request for the ADF planners the day before yesterday in the evening. We had those people, the planners, on the ground yesterday. I'm very confident that while they work to a 72-hour period in terms of having boots on the ground, I'm very confident that we will see some of that 120 on the ground tomorrow.
Can we ask Jerome some testing questions? Jerome, on the ski resorts, has it been clearly communicated to all the testing sites that they need to test asymptomatic people who plan on heading to the snow? Because yesterday we heard of some of those people being turned away.
Yeah, no, absolutely. Look, we sent out a couple of bulletins to all of our testing sites, 210 testing sites across the state, giving very clear directions around, people may come and present who intend to go to the snow. They have to get an asymptomatic test. They don't need to isolate. So that communique has gone out. I've spoken to all the CEOs only last night to make sure they understand that. So I'm confident those messages are getting through.
Also on the Pfizer vaccine, we've also heard of people who really want the Pfizer after yesterday's change to the AZ, making multiple appointments to make sure they get it. Yeah. They're not cancelling the ones they don't need. Is that resulting in Pfizer vaccines being thrown out? No,
absolutely not. So we have a centralised booking system for all of our booking appointments, and clearly, we understand that people will be keen to get hold of Pfizer. I mean, actually, I'm glad to hear that people are so keen to get vaccinated that they'll find their way through the system any way they can. But ultimately, we have a centralised allocation of Pfizer to allocate through our 49 state clinics. We have a centralised booking system. When people don't, if people don't show up for their appointments, then we will manage the supplies of Pfizer during the course of the day, and we continually update our use of vials, our use of doses during the day to make sure we don't get any wastage. Our wastage factor is 0.2% or something. It's very, very low indeed, and I think that's what we'd all expect.
Is this decision by ATAGI and then the Commonwealth going to have a big impact on our rollout? Do we have enough supply of Pfizer to cope with this latest change?
Oh, look, I think absolutely it will have a significant impact on the speed with which we can roll out within the vaccine that's available. So, look, we currently have, as we've discussed in this room a number of times over the last week or so, we have a fairly constrained supply of Pfizer in the near future. So certainly for this month, for July, we have a 6-week projection. We're stepping down to 80,000 or so doses of Pfizer a week from the beginning of July, with more people now being guided towards Pfizer, the 50 to 59-year-old age group. That means there's more contention for a very limited supply of Pfizer. That does present real problems, and particularly for us here in Victoria, where we're so keen to get vaccinated, then that gives us a real constraint. Absolutely.
Can the impacts of this decision, can it be characterised as anything other than a significant ramping down of the program?
Well, it's a setback to the program in that we now have more people to vaccinate with a limited supply of Pfizer. Now, certainly, I think our colleagues in the Commonwealth are indicating there will be more Pfizer available towards the last quarter of the year, and I'm hearing indications there may be more Pfizer available certainly in September, possibly in August. We don't have those projections at this point in time, and if that Pfizer is available through our GPs and through our state clinics, then of course we can keep picking up the pace. But what we've done in Victoria through the GPs and through the state clinics is an unparalleled ability to get people vaccinated. We're running at 50,000 people a day, or we were running at 50,000 people a day, 350,000 people a week. We've seen a massive upsurge in the last 4 weeks. We'd like to keep that going. With the ATAGI recommendation, the Commonwealth decision, that means we need to either we either have more people competing for the same amount of Pfizer, or we need to get more Pfizer to maintain the momentum that we've built up.
You were just about to say the word slow, I think, but you stopped yourself. But before this decision, there seemed to be a kind of a growing confidence among people to take the AstraZeneca dose. There were a doubling of doses to GPs. Yep. There was less media reporting on the clotting disease. What's your reflection on the Commonwealth and ATAGI's kind of risk appetite on this? Was there disappointment at the decision based on how strongly we were going?
Look, I think we've always said, we will follow the best medical advice, and we absolutely hugely value the work of ATAGI and the difficult judgments and decisions they have to make, and the fact that they're making evidence-based, data-based decisions based on the emerging reality in Australia is a very good thing. And I think as Australians, that should give us all confidence that they have our best interests at heart, and they're looking at all the evidence to make these very difficult judgments and recommendations. So I think that's an absolute benchmark of our program. All of us want to have confidence in the vaccination program, and although it's a little bit frustrating when you're running the state system that we now have more people who are going to be switching over to Pfizer, and we have so little Pfizer available. As soon as we see more Pfizer coming through, then to some extent we can recalibrate the program. Certainly here in Victoria, we can step across and make this Pfizer switch very easily, but we need a vaccine in order to do that.
What would you say to people who, as a result of yesterday, who are eligible for AstraZeneca, who, as a result of yesterday's decision, are now deciding that they're going to hold out for Pfizer, even if that might be 4 or 5 months away for them?
Sure. Look, Rachel, what I'd say is, first of all, if you have any doubts about the vaccine options available to you, please speak to your GP. It is your GP who can give you the best advice about what's right for you and your circumstances. At a general level, as a non-clinician, I'd say, look, it is, we're in the middle of winter. We are seeing, we're coming to the end, we think, of an outbreak here in Victoria. We're seeing rumblings in New South Wales. We've got a long way to go at a pretty cold time of year. And I'd encourage anybody who is eligible to get vaccinated, please get vaccinated. If you're 60 and above, I would look at the ATAGI guidelines and say, well, that's their judgment. Is that it's safe for those of us, or those of you over the age of 60, not me yet, to get vaccinated with Astra. I think for those of us who have had a first dose of Astra, then I would, the advice has been very clear from ATAGI and the medical profession, please go and get your second dose. So we'll certainly, from a state system point of view, we will make all of that available. We will, every single dose we get, we will put into people's arms, and what is most important is that the momentum that we've built up for Victorians to get vaccinated doesn't slow down.
Suggested.
The 8,500 vaccine appointments you still have available for
Yep.
Pfizer this week.
Yep.
Is that a notable slowing compared to previous weeks? I know even though it's a race, you did say you'd be stepping it back just to ensure the second doses. So how much does that play into the numbers?
No, so it's been pretty much my almost my daily update in these last few days to kind of indicate that we still have second dose appointments available. So we've known, and we've been forecasting for the last 3-4 weeks, that we would see a significant number of people coming due for their second Pfizer dose from this week, and there's that 3 to 6 window that people have to get their second doses done. I've still got 8,500 second dose Pfizer appointments available this week for the next 3 days. I'd really like those to be used by the people who are due to get their second dose. I've got, I think, 27,000 slots are free next week for second doses. So we're very keen to make sure that people who are on that vaccination journey complete it. So if you're due for your second dose of Pfizer, book it in, because we have those appointments available. I'm holding the vaccine, I'm holding the spaces to do that. Equally, for those of us coming due for our second AstraZeneca doses, again, the vaccine's certainly there, and we have the capacity to do that.
Can they be switched to first doses or no?
No. So I mean, look, we will. Oh, in terms of the appointments.
Yes.
Oh, look, I think we'll be very pragmatic. I mean, ultimately, we've made a very clear decision to prioritise capacity for second doses so people can complete their second dose appointments. As we go through the week, if we're seeing, if we're really seeing a drop off of that demand, we'll make more appeals through like this. We're following up with people. Ultimately, the Pfizer itself will not get wasted, and we will then redeploy into first doses. But my real encouragement is, if you started your vaccine journey on Astra or on Pfizer, come through for your second appointments, and let's get this done.
The Commonwealth has indicated that it's confident all Aussies will be given at least one shot by the end of the year. Given this recent setback, do you think that's achievable in Victoria?
Oh, absolutely. I mean, I think we've demonstrated we're running the largest vaccination program anywhere in Australia. We can step up. We could. The state system is running at 170,000 capacity a week at the moment, without really stretching itself too far. We could absolutely step that up further. So it is all about vaccine supply, and that's a predicament. I think what we're being led to believe is that there will be a lot more supply available in the last quarter of the year, and that will make it a bit of a sprint towards the end of the year. And as I think certainly I said yesterday, we'd like to bring as much of that forward as we can. I'd like to get people vaccinated now in the winter when we are more vulnerable to COVID. There's no reason to delay, but obviously we need the vaccine to come through to do that.
If I'm eligible for Pfizer, my first dose, when realistically could I go and get it?
Look, as I've said, I think there are some first dose appointments available in the coming weeks for Pfizer.
But not next week?
Not next week. No, next week we've reserved those 27,000 slots for second dose appointments coming up. There are some first dose appointments I think available in the weeks further out. And again, with 49 clinics, there's a fair geographic spread of opportunities. So if you're eligible for Pfizer now for your first dose, hit the website or call the contact centre and see what's available. But we are at the moment, in terms of our projection of vaccine supply, we're running at around 100,000 doses or so a week at the moment. That steps down to 80,000 doses a week from the beginning of July. That means I've got fewer people that I can vaccinate from the beginning of July onwards. At the same time as the target is encouraging us to shift towards more people into the Pfizer platform. So it will be a congested space over the coming weeks, unless we see more vaccine come forward.
And when you make that first dose booking, is there the capacity to make the second dose booking at the same time yet?
No, not at this point. And I think the way the way we've set this up is that we're very keen to get people through on their first doses. There was a real push over the last 4 or 5 weeks to get the first doses done. What we have seen from time to time is that when people book multiple appointments, and it goes to the earlier question, we then end up with a lot of booked appointments in the system that then don't get taken up, and you end up with a lot of wasted capacity in the system. Our focus has been on, let's get the vaccine we have through as quickly as possible. I don't think it's an unreasonable ask, given how precious the vaccine is, suppliers is at the moment, that we encourage people to book their first dose, have the first dose. The clinics are absolutely, when you complete your first dose, the clinics are being asked to book people in for their second dose at that point in time. The online system makes that very easy, and we've got a pretty big contact centre that's got pretty short wait times.
How is it possible that people are able to book so many appointments at once?
Sorry?
How is it possible that the system allows people to book so many systems?
I don't think it does, to be honest. I mean, the system we have, requires you to register, requires you to give, your Medicare details, etc., in order to book your first dose appointment. So the system does not allow you to make multiple appointments. It allows you to make one appointment at a time for your first or second dose, whichever one you're due to get.
Is there any capacity to prioritise people in their 20s and 30s?
No, I refer you to my answer I gave yesterday. So we are part of a national rollout. The Commonwealth programme set very clear priorities for the order of the rollout. We have followed that through here in Victoria at this point in time. The prioritisation is 40s and above, and those critical workforces. And look, again, with the limited supply we have available, now is not the time to start opening up, more people to compete over a very limited supply.
And just, do you want to ask on that topic?
Still on vaccines. There you go. Do you want to go?
Oh, I've got to ask about the next one.
I'm very polite today.
I'm only polite,
Can I
Blake.
just take you back, John. You said we're seeing wasted bookings if we allow those second dose bookings, but then you said we're not seeing duplicate bookings because the system allows it.
It doesn't. So let's be very clear. The system does not allow duplicate bookings. I was asked to respond to a question that said people are saying they've got multiple bookings in different ways. I've not heard that before. Okay. The system does not allow multiple bookings.
People may be making a booking and then also walking up, or what's happening?
That's entirely possible, Rachel. Any number of things could be happening. And I think, what we're seeing is, what we said at the beginning of this week is that people can book in for their Pfizer. You can't walk up for Pfizer at the moment because our prioritisation is on those second doses. I think the consistent picture we've seen emerge during this week is, we said, this time last week, we said we're going to focus on second doses come through. We've seen lots of second doses being delivered this week. I still have vacancies for more second doses to be done over the next 3 days. And if you're sitting there and you've had 3 or more weeks since your first dose and you haven't had your second dose, then come and get it.
Do you have a percentage of how many people aren't turning up for their vaccines?
No, I mean, again, there is always, in any appointments-based system, there is always going to be some wastage, some people not turning up. I haven't got a number.
But is it a concerning number?
No, not really. No.
What is that private told you about why that nurse was working at the Northern and went to the vaccination centre?
Yeah, look, as I said yesterday, I spoke to the CEO at Epping Private and other CEOs in that neck of the woods a couple of days ago, and we had an honest and frank conversation about the obvious concerns we all share. It would appear there's some lack of control over the rostering system and the attestation system that's being used. They understand that, they understand what they need to do, and they're doing it.
What does that mean?
So every in the way we run within what health service workers are asked to do, particularly in those sensitive wards and COVID wards, is to provide an attestation that says they're not working at multiple sites, and that's a pretty self-evident and important thing to do. I think what the feedback from Epping Private was that there was some, they weren't confident that system was working as well, that either the staff were not understanding it well, or they had it controlled as well as they should do. And look, that is a job of a hospital to
Are you working? She asked that.
An attestation system, as I understand, to make that attestation. I don't have the detail of that. I don't look at the form that they're signing off on. But I think what the hospital management accepts and recognises and is owning, and fair play to them for owning it, is that did not work. That ultimately they ended up in a place where they have a member of staff who's working across multiple sites while she's on one of our most precious and vulnerable wards, and that's not something we want to see happen. We all understand that, and putting the measures in place to make sure that doesn't happen again.
Are you confident that this isn't happening in other hospitals that have COVID wards?
Yeah, I spoke to all the CEOs of the health services who oversee the COVID wards, and we had a fairly big meeting this morning, and we went through the learning points from this and the fact that this we all agreed this could not happen, should not happen, and will not happen again.
Would you say it's a case of a lack of oversight and education for the workforce, or is it a case of an exceptional case of dishonesty by one of them?
No. Let's not go to the individual. There is a management job here and there's an accountability job here, and what I expect any organisation to do who works with us is to own and to be accountable for the decisions and the controls they have in place. The expectations of what controls needed to be there were very clear. That is not disputed. There has been clearly a lack of grip on some of those issues. That's now been dealt with.
So is it a failure on the part of the hospital or the individual, or both?
Look, I hold the hospital accountable. That's who I have the relationship with. And we've had, as we said yesterday, we've had a very honest and frank set of conversations. They've owned the issue. We're not walking away from it. We all need to do better, and they will do so.
Do you have any more details about that potential breach, IPC breach you said, which caused that nurse to get COVID potentially?
No, I don't, no more details than I discussed yesterday. We understand some of the dynamics. There's some investigation work still going on. My going assumption is that we have an IPC breach, and if I'm honest, we all have to accept. These are complex and sensitive processes that people are dealing with in these wards, and we've got real human beings who need sensitive and delicate treatment. There is always an opportunity for things to go wrong. That is why we have multiple safeguards in place. And look, in fairness, the safeguards work to the extent that the nurse came forward to get tested. We've got a very swift COVID response. We have a large number of people who are now isolating. That is part of that response, that safeguard for the wider community. Both hospitals continue to operate safely, but obviously I'd much rather that the other safeguards are kicked in a bit earlier to minimise that impact.
Do we have the genomics come back? Yeah. Do we have the genomics yet to show that?
No, not yet. Okay. I'll update on that hopefully this afternoon.
And why is it taking a bit longer than normal? We've had genomics back the day after.
I'm a bit surprised. I wasn't advised of the update for the genomics this morning. I'll go and check after this conference.
On that, one of the exposure sites for this nurse, I think, was the Berkeley Square Shopping Centre in Brunswick, and a couple of shops there that had also been exposure sites a couple of weeks earlier. Is that just coincidence as far as you're concerned?
It's coincidence. I mean, people move around, popular places within the CBD. And again, if I may say, this is obviously we all, none of us wanted to see that case turn positive. I think the fact that we've caught it. We've caught it in a period of time where the movements were relatively limited, so we don't have a huge number of exposure sites. We've seen a great response from people coming forward. That 60,000 testing result for 2 days is a really strong indication that I think we've got a pretty comprehensive view of any other potential people who may have been exposed.
We're at the airport this morning just getting some interviews with people flying to Sydney. None of the people that we spoke to were aware that Sydney was the orange zone. You had to get tested when you come back. Now, you can't plead ignorance, obviously. However, is there perhaps a system where you can contact people via text message if they are flying out to warn them that this is a requirement when you come home?
Sure, and Blake, this is a challenge. I mean, clearly, what we did do yesterday is send out 4,700 odd text messages to those Victorians who we knew had arrived from Sydney from those 3 LGA areas. Obviously we're not quite omniscient. We don't quite know who's thinking about going to Sydney and to be able to text them before they actually take off. So that is a bit of a challenge. That's why we use that travel declaration system. That's why we use that. That's why that process is so important. That for people who are travelling interstate, please use that travel declaration system, because it allows us to get in touch with you if our settings change. And as we've seen before in over the last 6-12 months, these situations can change quite quickly. So yesterday evening, 5-6 o'clock. We declared those 3 LGAs as orange zones, and I think that's consistent with what other interstate colleagues have done. There's every chance that might get tightened if the New South Wales outbreak gets worse. We will have to reflect on that and change that. Of course, we all hope it gets better so we can ease it off as soon as possible.
Have you noted the use of the word fleeting transmission by the New South Wales Premier today? She said it about 10 times in her press conference.
Right, well, it's, I'm very, yes, great.
Can I go to the Deputy Premier?
I haven't followed the New South Wales press conferences very closely, but we are working closely with their team, and fleeting transmission is something we all have to deal with these days.
Thank you. Can I go to the Deputy Premier? Is everyone okay with that? Yep. I know Jeroen's going to these points, Deputy Premier, but how big a setback is the Commonwealth decision last night, and do you think there was enough consideration of the tight Pfizer supply in that decision?
Oh, look, the advice of ATAGI, the decision of the Commonwealth, there's no doubt that this is a setback. And as we've seen before, with a similar advice and decision of the Commonwealth, there's a hit to public confidence. And it's really, really important, as Jeroen said, if you've had your first dose of AstraZeneca and no adverse effects, please get your second dose. But there's no doubt that there'll be a hit to public confidence. At the same time that we're seeing a reduction in the number of vaccines that are supplied to Victoria in July. So we're seeing a 20,000 reduction in vaccines from 105,000 to around 85,000. At the same time, we've got this advice, which will hit public confidence and increase demand for that cohort of people, 50 to 59, to get a Pfizer jab. This is a race. And as a nation, we're falling behind. That is the reality. We do not have, from the Commonwealth, sufficient numbers of vaccines for second doses to match the demand for first doses. That is a fact. Now, that may well change later in the year, but right now we are falling behind as a nation in this race. There's no national campaign to increase public uptake of vaccines. And why is that? Is it because the Commonwealth does not have confidence that they've got supplies of vaccines to match what will be an increase in demand? Now, I've acknowledged a number of times that there are global supply constraints, but the Commonwealth has had well over a year to address these issues and provide greater levels of confidence to GPs around our nation, to state and territories in terms of our sites that we're responsible for, but we simply cannot meet the demand that is out there. And now we've got this, the advice and the Commonwealth decision that will have an impact on public confidence.
Acting Premier, I've asked you before about whether you thought there was no national campaign from the Commonwealth for vaccinations because they're not confident with supply, and you brushed it off. Why are you changing your tune now?
Oh, look, I think, you deal with the reality on the ground, and the reality is that the Commonwealth made it very clear, as I said, I've said it a number of times, very clear at National Cabinet to states and territories, don't worry about second doses, we've got all you need. They said that at National Cabinet, they said it publicly. But the reality is that is not the case. The Commonwealth do not have the supplies of Pfizer to meet the demand, supplies of second doses to match the demand for first doses. And this is a challenge. We've got to balance the demand as best we can. So we've got to tweak what we can provide, and that is why in terms of people that between 50 and 59 that have got a booking for AstraZeneca, we're going to switch them over to Pfizer. But that means we've got less to do what we were already planning to do. This just gets harder and harder and harder. And I've acknowledged global supply chain problems, but the Commonwealth have had more than a year to resolve these issues, and we are falling behind in the race.
Would there be any point in a public campaign to get people to get vaccinated over the next 3 months? There's not enough supply for it to ramp up. Are we effectively just going in?
That's exactly the point I'm making. Why don't we have a national campaign like we've seen in other jurisdictions? A fantastic ad in France that I saw recently. We don't have a national campaign to increase the uptake of the public in terms of vaccinations. It must be because the Commonwealth do not have confidence in their supply to match the demand that will be generated by such a campaign.
The Commonwealth has said before that they suspect that Victoria had been using its allotment of first and second Pfizer doses solely for first doses. Is there any truth in that?
Look, we are doing more than anyone. In terms of the total number of vaccines, we lead the nation. Last week, 130,000 doses, almost 40% of the nation's vaccines, 91% utilisation, more than New South Wales, more than Queensland, more than the Commonwealth. So when we get the vaccines, we deliver the doses. Now, we need to, because we don't have confidence from the Commonwealth that they do indeed have the vaccines for second doses, we need to allocate spots to ensure that those Pfizer vaccines, people that are scheduled for their second dose, actually get it.
We put all our vaccine eggs in two baskets, and one of them is considerably smaller now. Do you think we've shot ourselves in the foot in terms of just going with Pfizer and AstraZeneca only at the start?
Well, these are matters that you should put to the Commonwealth. As I've said today, the government absolutely acknowledges global issues, but there's been well over a year for the Commonwealth to get these matters sorted. The fact is, from today, there's going to be a public hit to confidence in terms of AstraZeneca, and we've got less Pfizer to give at a time we've got increasing demand. We are falling behind in this race.
We're the only state that consistently goes in and out of lockdown. We're the state that's going.
But anyway,
I don't think it's false.
It is.
We're going into winter. We're a cold state. We were in this situation last year. The opportunity cost of not having a high vaccination rate is probably highest in Victoria. Do you think that the decision making of the Commonwealth would the decision making be different if there was a greater acknowledgement of the situation, particularly in Victoria? Is there not enough of a view of what's happening down here and more of a view of the other states where it's less of a risk because lockdowns don't occur?
Okay, well, let me cover a couple of things you just mentioned. In terms of lockdowns not occurring elsewhere, well, that's patently not the case. We've seen lockdowns in WA, in Queensland. In terms of the public health advice that we receive here in Victoria, there are circumstances where we do not need to go into lockdown. Black Rock and other outbreaks, we did not need a circuit breaker lockdown, but there is advice similar to right across this country, particular outbreaks where you do need to go into a lockdown for a period of time and have restrictions setting. So the first part of your question is false.
They occur much more frequently in Victoria. That's indisputable, and for longer periods.
The second part of your question, well, we've had outbreaks right across the country, and we've had periods of lockdown and periods of restrictions right across the country. In terms of the second part of your question about the weather, and as Jerome talked, we would much prefer to have greater levels of vaccine now in the depths of winter when we are vulnerable. We are a colder state than other parts of the country, so therefore that is a correct point. It would be better to have confidence in supply from the Commonwealth in terms of vaccines in Victoria now, in June, July, August, in the depths of our winter, rather than saying, oh, don't worry, we're going to have plenty of vaccines in September, October, November, December.
Acting Premier, we've heard reports that our Chief Health Officer recently went on a work-related trip to Canberra, a dinner and an awards ceremony. Do you think that this is sending the right message to Victorians, given that up until today they haven't been able to travel further than 25 kilometres from their home?
Look, this was a work-related event, and the Federal Health Minister was asked this question and gave a similar answer. It's an appropriate work-related event for our Chief Health Officer within the rules that all Victorians abide by, and I think it was appropriate.
But do you think that it sends the right message?
Victorians have had to cancel weddings. There are Victorians who can't visit loved ones in hospitals at the moment because of the rules that the Chief Health Officer has put in place. Was it a good look?
Well, as I said, this was the CHO is a member of this national body around medical research. There was a work-related event. He's entitled to go there. The Federal Health Minister says the criticism of the Victorian CHO is unfair in these circumstances, and it was within the rules. It was a work-related event. It is important work that this organisation does, and it's appropriate that the CHO went.
Did you have a conversation before he went? Did you approve him going on this trip?
It wasn't a question of being approved by myself or anyone else.
Did you know about it before he went?
No, again, because it's a work-related event.
But you were unaware.
The Cho travelled within the rules. As the Federal Health Minister, Greg Hunt, has said, the criticism is unfair. This is an important body in which the Cho is a member of, doing important work at a national level. It would not be something that would come across my desk.
So
Do
you
you
weren't
think the
aware.
debate around the optics is unfair?
Look, I think the criticism is unfair. This is a work-related event that the Cho went to within the rules, and we do. I understand the questions and respect the questions. We all get frustrated with the restrictions and the rules that are in place. But this was within them. It was work-related. This is an important national body. And as the Federal Health Minister has said, the criticism is unfair.
At a time when Victorians weren't allowed to have visitors over to their household to see family, to see loved ones, would you have done the same thing?
Well, I don't have any events that require me to go either interstate or overseas.
And if you
we've
did,
seen the
would you have
Prime
gone?
Minister go overseas. National Cabinet is done online. You respond to the rules that are in place, the restrictions that are in place, and you also respond to the work that you need to do, whatever our role may be.
If you had an event, would you have done the same thing?
Oh, look, I'm not going to go into hypotheticals. We're dealing with a pandemic. We're dealing with massive damage from a major storm event. I'm simply not going to stand here and talk about hypotheticals.
Do you think
An
it's...
event that could have been done on video conferencing, like the rest of the country for the last 14, 16 months?
Look, there are some activities that can be done online. There are some activities that require people to move around this country, and people can move around within the rules.
But this was a dinner and an awards ceremony. Is that something that's essential, that you need to go for, that you would have gone for?
Look, all I can say is that this was a work-related event. It was appropriate that the Cho was there. As the Federal Health Minister has said, the federal government feels that this criticism is unfair.
Shouldn't he be held to a higher standard?
No, I cannot describe the event because I was not there.
But do you know what it was?
To a higher standard, given that he's the one advising about restrictions and lockdowns?
Look, I think I've answered the question. It was a work-related event. It was appropriate that he was there. The federal government have said it's appropriate that he was there, and this criticism is unfair.
And why is he not here today answering these questions?
The Deputy Cho, Professor Cheng, will be appearing at PAYAC with other public health officials. The Cho is on scheduled leave and has been on that scheduled leave. That leave was scheduled for some time.
There are plenty of times the federal government says something is acceptable and you completely disagree with them. Why should we take the federal government's word for it on this occasion?
Because Rachel, on this occasion, I do agree with them. I'm never scared to say when I disagree with a position of the federal government. On this occasion, I agree with them.
What do you say to Victorians who are angry over the fact that he's left during a period of such tough restrictions?
Nothing that has occurred is outside of the rules that are in place for all Victorians. We all need to abide by the restrictions, the rules that are in place. Nothing that has occurred is outside of that.
Do you think it's justified that people would feel frustrated and angry over this?
Look, I think I've answered the question a number of times. This is an important national body around medical research. It was a work-related event. The federal government has said it's appropriate that Professor Sutton was there, and I agree with that.
And that aside, is it warranted for people to be
Look,
frustrated and
frankly,
angry over this?
I've answered the question. I appreciate the interest, but I've answered the question a number of times. I don't want to repeat myself to you or to anyone listening.
There's an under-16s basketball team from Victoria, acting premier, that was set to go to Perth, Western Australia. At the last minute, the government there said no because the accommodation wasn't suitable. What's your take on that?
Look, this is it's incredibly disappointing to the under-16 teams that were scheduled to go to Perth for these activities. Basketball Victoria got in touch with my office late yesterday, and I completely understand their frustration. Look, it's inappropriate for me to have a go at public health advice in other jurisdictions. They're the rules that WA Health have set for anyone travelling in from Victoria for that event, and it's appropriate that they make their decisions. But I do understand the frustration. I'm dealing with it as Education Minister in trying to work out how best we can deliver those interstate, national sporting competitions within our government school system across the nation, and it's a very hard thing to deliver in this current environment.
Would you have liked to have seen the ADF called in sooner for the
No,
storm?
I think Commissioner Crisp has gone to this, and it's. I appreciate the questions, and I absolutely understand as a local resident in the Dandenongs, people want to see masses of people on the ground doing the clean-up. So I understand and I empathise with the questions about the ADF and about the speed in which the clean-up is happening. And that's why it was really important for me and the Commissioner Chris to outline to the community exactly what is happening on the ground right now. Like I've seen for myself, the incredible work in terms of clearing roads, clearing properties that have happened to date. The initial 24, 48 hours is about saving lives and saving property. And the SES, CFA and other emergency services did a sterling job. Then the next phase is coordinating all of the state supports that can come in. Forest fire management, other areas of DELP, VicPol, SES, CFA, FRV, all of the supports that the state and all of its agencies can put in. Then it's appropriate that there's then an assessment about, okay, what else do we need, either from the ADF through the Commonwealth or from other states and territories. And that's exactly the work that Commissioner Crisp has taken us through. The initial ask of the Commonwealth was for logistical and planning support from the ADF, and now we're confirming that a further request of 120 ADF personnel will be made, and we'll have those people on the ground. But right now, alongside all of the volunteers, all of the state agencies and AusNet crews, that's around 1,400 people on the ground right now supporting communities across our state.
Locals in the Dandenong Ranges are complaining that they weren't allowed to remove trees threatening their properties due to council regulations. They now say those same trees have caused damage to their properties. Are locals right to be angry about this?
In terms of local government planning, and planning, as you imagine, is a passionate issue in the Dandenongs. In terms of the local government arrangements, you would have to talk to the local government. People live in the Dandenongs because they love the trees, they love the environment. But in terms of my focus right now is on the cleanup that's required. We know that there's more rain and wind coming. There'll be many trees in the Dandenongs that have been weakened by the previous week's storm, and that's why we need to get those warnings out in terms of the weather that people can expect, as well as making sure we have as much support on the ground as possible to make the place safe, to clear all of the roads, and to get our communities connected back to power as soon as possible.
On Sydney.
Disaster payments. Sorry, Em. In addition to the disaster payments, we've spoken to farmers, for example, who've lost a considerable amount of their operations, infrastructure-wise. Insurance is only going to cover about 10% of that. Are any discussions underway to try and assist them?
So there's a couple of things happening. There's the immediate personal hardship. Then there's the re-establishment grants of up to $42,250. These are available right now, Commonwealth state arrangements. Then there's also engagement that the Emergency Management Commissioner will coordinate with all of the local governments affected about what has been the broader impact. So, for example, in Gippsland, a lot of focus on our dairy farms. So that's in terms of the phases that we've been talking about, that's another one of those phases where we look at livestock that has been lost, farm properties that have been damaged. That assessment is happening right now.
On ski resorts, tourism bosses say this new testing rule has killed Victorian resorts. We're hearing reports that Victorian resort workers are heading over the border to work in New South Wales resorts. What do you make of that? And should ski resorts have been briefed by the government on this new rule rather than finding out through the media?
Look, there's a couple of things. One is that there's engagement with our ski resorts through government, through Department of Jobs Precincts and Regions, through the Minister. So there's constant engagement about how we can support the resorts. A pandemic is a dynamic situation, and the public health advice was that we've got a higher risk in our resorts, and Professor Sutton went to those risks in some detail. The most common sense response to the higher level of risk in our resorts, to try and support the resorts and the hundreds of businesses often on the mountain that support our ski season, is for people to take a test, show that they're negative, and then they can go up the mountain to the ski fields. I understand, it's an additional ask on our resorts. I understand that it has an impact, but it's better to do that and keep our ski season going, because it's got such a limited, portion of the year in terms of securing revenue for the year. That our focus was, how can we support all of the businesses, the resorts and all the associated hundreds of businesses often on the mountain, but still address the higher risk settings. I know it's difficult, but I think it's the best way forward.
Do you think the testing rule will last longer than the 7 days, or do you?
Mitch, that'll be subject to public health advice. As we've seen across the course of the last few weeks of this lockdown, and then periods of restrictions as the lockdown has eased, I expect to be in a position next week to announce further easing of restrictions. Whether that includes any changes to the settings that we've got in the Alpine regions, that'll be subject to public health advice.
Just on New South Wales, possible border closures always cause a lot of angst. Do you have any further advice to people who may be travelling to New South Wales or have plans to in the next couple of weeks?
No further advice today. We made the decision late yesterday in terms of orange zones for those 3 areas of New South Wales. We will monitor the situation on an hourly and daily basis. If and when we need to change it, either to go to red or to lower it from orange, that'll be based on public health advice.
How sure are you? When we'll be able to travel to other states? We understand New Zealand is working through that, which is quite laughable that we might be able to go overseas but not to Queensland.
Again, they're decisions that Queensland authorities will make in terms of Melburnians hoping to get to Queensland for our school holidays, particularly important. So I know that Queensland said that they want a further week. I would hope, we're on a cautious but positive trajectory. I expect to be in a position next week to announce further easing of restrictions, and would expect that other jurisdictions, in terms of their travel arrangements for Victorians wanting to travel into the state, they would reflect the changes that we can make.
Are there particular restrictions that you want to see eased straight away or in that week? What are the top of your?
I think what we've been seeing over the course of the last few weeks is Melbourne coming much closer to regional Victoria. So this week we were able to remove the 25-kilometre limit and the difference or the travel restrictions between Melbourne and the regions. We've still got stronger settings in some areas in Melbourne compared to regional Victoria. But I don't want to foreshadow what the changes may be, but obviously as we go forward, getting closer and closer to the arrangements with regional Victoria.
Just a really quick one for Jerome, if that's okay. Just on the nurse, you said yesterday she'd attended a vaccination clinic. I understand that was for a second shot.
That's right.
Why wasn't she fully vaccinated if she was working on the only active COVID ward in the state?
So there is an expectation that all staff in those COVID wards are vaccinated, or at least have started their vaccination journey. My understanding is that this individual is an agency nurse, and the first dose timing and the second dose timing still need to be respected. So we understand, our health services, particularly at this time of year, are hard pressed. I mean, there's a lot of, there's thousands of hardworking people out there keeping all of our health services running. So, ensuring that you retain staff who are fully vaccinated and don't work at multiple sites is a real challenge in this environment. But that's what we expect people to do. I'm confident that the positives aspects of this, Rachel, are that we have got staff on those wards who are all vaccinated, have at least started their vaccination journey. I don't think that's unreasonable.
Should we have agency nurses working in situations like that when we've only got 3 hospitalised COVID patients in the country?
Again, as I said, look,
state,
we've got we've got a large and complex health service sector. I'm not going to stand here and shoot from the hip on wider health service reform. I think the issue for us is that we want to make sure that staff who are working in our most vulnerable wards are only working in those vulnerable wards and are vaccinated and supported to do so. Beyond that, that is a matter for the hospitals, how they manage it effectively, and I've gone to that a couple of times over the last couple of days.
There would be a lot of nurses who have had both shots, so why don't we have nurses with both shots working in those COVID wards?
Again, this is a matter for the hospitals and the health services and how they manage their staff rosters, and certainly in my conversations with the CEOs that I have on a regular basis, managing your huge staff cohorts and the multiple challenges we have in our health services is not an easy matter. So it's not as simple as saying we just corral people in this way and that's all we have to do. It is a very...
Surely the government would have control over that, over which nurses are working in COVID wards, given there's so few of them.
No, I think ultimately we rely upon good operating and safe clinical practices within our health services to manage those competing demands and requirements. And I think the restrictions and the directions we put upon our health services are enough. I think the feedback I've got from the CEOs is that our expectations on them are clear. They have a management responsibility to own and manage. That's exactly what they'll do. And when that doesn't quite work, as it has in this case, we work with them to fix it and to make sure it doesn't happen again.
Can you confirm that all other personnel working in the other COVID wards are fully vaccinated?
That is absolutely our criteria and our requirement of them, and that is.
Can we confirm? You said you had follow-up meetings with the CEOs of these hospitals.
We have re-communicated that to all the CEOs, made it very clear that's the requirement. The delivery on that and the accountability for that, they fully embrace, rests with them. We will continue to sit and work with them day to day to make sure.
Did they give you that assurance this morning when you spoke to them?
Yeah, I mean they've continued to give that assurance to my team. Absolutely. Okay.
Thank you.
Thank you all.
Thanks, everyone.
Fingers crossed anyway, right? That's ready to go.